to Adjusted Reality, a podcast series trusted by the adjusted and brought to you by the Foundation for Chiropractic Progress, where we learn from athletes, celebrities, influencers, and healthcare professionals about how to optimize health in a fun, relatable way. Join me, Dr. Sherry McAllister, as we welcome successful businesswoman and well-known political leader, former Congresswoman Mary Bono. Mary Bono was hailed as the embodiment of powerful American womanhood by Washington Times during her tenure in the United States House of Representatives. Mary was elected to Congress in 1998 to serve California's 44th congressional district after the untimely death of her husband, entertainer turned congressman Sonny Bono. She established herself as a respected and closely watched leader on a wide range of critically important issues while serving 7 terms in Congress. Today, Mary is widely recognized as a national leader on multiple issues, including addiction prevention, treatment, and recovery. While serving in Congress, she co-created the first ever Prescription Drug Abuse Caucus and chaired hearings specific to the opioid abuse epidemic. She continues to be at the forefront of the nationwide fight against drug abuse and the fentanyl epidemic, both of which impact every community in this country. She currently serves as the chair of the Board of Mothers Against Prescription Drug Abuse. I want to warmly welcome you, Mary Bono, to Adjusted Reality.
Thank you, Dr. McAllister. It's great to be here with you.
Well, you are a very, very busy and very well educated on the topic individual who really takes forth the missions that a lot of people run away from, and you run straight in like a buffalo in Colorado, right? Run straight into the storm. Let's start with, as a volunteer chair of the board and CEO of Mothers Against Prescription Drug Abuse. Tell us what spurred you into action in getting involved in this particular organization.
Well, that's a great question and very important because it's really shaped my life. I had a family member who became addicted to prescription opioids over a decade ago, and he was using them recreationally. And truthfully, he thought opioids, they came in a brown bottle, so they were safer than all of the drugs his peers were doing. And it was at a time when it was sort of on the uptick, this prescription opioid epidemic. So I lived through what it means to love somebody who has struggled with opioid use disorder, what it means to try to go through recovery, what sort of toll that can take on the family, what kind of collateral damage an opioid addiction can take. So it was very personal for me, a very personal journey. But I want to tell you, this family member is doing very well, received a master's in clinical psychology, and that is now practicing in the field. So there are good stories, but the challenges are rough. But when we first went down this journey, we spoke about it publicly. I was a sitting member of Congress, and we realized that other people were facing the same issue, but nobody was talking about it. Nobody was talking about the burgeoning prescription opioid abuse epidemic that was beginning to take countless lives. And it was hard in the beginning. So many people were in denial, whether it was politicians, policymakers, the medical community. Nobody really wanted to believe it was an epidemic. So I took the challenge on, and I've been doing it. It's a labor of love. And for some reason, I keep doing it, and here we are.
Well, thank goodness that you're out there and you're really taking on the very difficult questions and trying to find answers. And I think, Mary, one of the big pieces to that is having the emotional experience that you've gone through, having that empathy and starting to push forward. And this campaign that you're currently working on, The Painful Truth, I know that it wasn't easy for everyone to come together and do it because sharing these stories they're hard. The audience that is listening right now, I'd like you to share a little bit about the campaign, if you would, about The Painful Truth and why you partnered on this particular project.
Well, this partnership was just a natural when I heard what it was all about. At Mothers Against Prescription Drug Abuse, we've been talking about the importance of a conversation for years and trying to bring this conversation out of the shadows where it exists because of stigma. But when they presented this idea to me, it perfectly aligned with our mission. Again, that, opioids, well, think about this, approximately every 30 minutes in America, somebody dies of a prescription drug overdose. And the use of opioids brings serious risks, as we know, serious risks of addiction, abuse, potential loss of life. Yet opioids are more widely prescribed in the United States than anywhere else in the world. So I believe that when I started this journey, opioids were sort of the gold standard for pain treatment. And I can tell you countless times, Dr. McAllister, when I was I don't know what you want to call it, heckled, given a hard time, but a lot of doctors who would tell me that I was wrong and that this wasn't their problem, that they prescribe opioids for pain, and what happens to that patient after they leave the office is not their fault. We also had doctors refusing to admit that, over prescribing was happening. It was a whole different world back then than it is now. The good news is we're no longer in denial about the problem. And I think everybody's leaning in to find fixes here. But when you used to walk into a doctor's office with pain and say, whatever's, in my case, I suffer occasionally from a bad back. So your listeners might like to know that. Uh, and you go in and you would expect a 30-day supply of opioids. But after that, you need that conversation. And now you need to say, wait, what are the alternatives? I don't want an addictive opioid. What are my options? What else can I take that's non-addictive yet will help me with my pain? The other side of this is not just necessarily turning to another, analgesic. It's also what else can you do? In my case, if my back flares up, it's so counterintuitive, but I have to get on the treadmill and I have to move. It means I'm sitting too much. I've been on a plane for too long. When I was in Congress, I flew back and forth, West Coast, East Coast, practically every single week, and my back took a toll. But rather than reaching for an opioid, it's time to get on that treadmill. So these are the conversations that we're trying to encourage. I am not one that believes people should have to endure pain, but I believe there are options that you should pursue, and that starts with the conversation with your healthcare practitioner. What are those options?
You have endured, actually, figuratively and literally, pain that comes with being ridiculed for knowing what is really going on, but no one wants to hear it. And so I thank you for taking on that pain in Congress, because I know at the very beginning when we started this campaign with the opioid epidemic, it needed someone to actually call it what it was, an epidemic. And then the second part is you totally have inspired me. I do travel quite a bit, so I'm feeling your back pain literally, because you get into those seats and somebody before you sat in that seat and molded it for them. It's not good for us. But the interesting and beautiful part that I want our listeners to really reflect on is you found your answer, and it wasn't in an opioid prescription, it was getting on a treadmill. And so much of exercise releases your own endorphins and enkephalons, and that Mary is a very, very powerful message, is being able to search for your answers. And it's individual, and because not everybody travels like you and I, and that's a long plane trip, and it's a long time sitting still, and you try your best to do the best you can, and sometimes you need that help. And I thought it was so impressive when I saw the Painful Truth campaign come out and jumped right away onto, I want to help Mary Bono succeed in getting the message out, because the one person, Matt Robinson, it's such an emotionally driven story. And well, Mary, you brought us forward this very positive outcome of what you were suffering with. Matt's story was so shocking in how it was portrayed, and then you brought it was brought through hearing the stories of abuse and then being able to explore it, that really brought to life what you are working on and continue to work for. When you look at what most people in today's 2024 environment, they know the word opiates. Oftentimes, they don't know exactly what those opiates are, and sometimes, they'll get a prescription from their dentist and they didn't know it was an opiate. But can you share a little bit about more the risks of opioid when it comes to pain relief options and why you want our audience to be so aware of those risks?
First of all, it's important to have a conversation with your doctor about your pain. And again, ask about the non-addictive options to an opioid. But I will be the first to tell you that there is a time and a place for opioids. I don't want to get into when they should be prescribed or not because I'm not a physician. But it's also important to remember that sometimes, it's pretty quick. The number, whether it's 3 days, 5 days, the numbers really, people aren't on various sides of how many days it takes to actually become addicted to them. But the thing is, when you begin using opioids, you become habituated to them, and you need them just to feel normal again at some point in time. When I was in Congress and then after, we used to work hard on trying to get the numbers of opioids that we would be prescribed cut down. And again, there was pushback from some of the physicians on, well, then we'd have to see a patient again if they needed a second refill. But then that became, again, another talking point that went by the wayside because they recognized that a 30-day supply of opioids is just not what any patient really necessarily needs. So how do we tailor that down? How do we get that number down and make it, again, more specific to the patient and what they're faced with? But there have been many journeys here. That's part of it. Let me tell you a little bit, Dr. McAllister, about the stigma, the problem with the stigma that surrounds this. People, they're afraid to talk about it. They're afraid to talk to their loved ones about it. They're afraid, that there's a moral failing. And I know you must know this, but that there's a moral failing if you become addicted. And that's not the case. Addiction is a disease, just like any other disease. And I think you have to begin that conversation from that perspective to recognize that a good conversation, a good, healthy conversation is what has to happen. Again, but start with your doctor, talk to your doctor, talk about your pain with a doctor. And I can tell you, doctors are on board now. Again, I keep saying that. I'm hitting this home because I'm so happy to say it. I also believe that if you walk into a doctor's office and you say, I have pain, but I don't want an opioid, I think the doctor would be very happy to hear that a patient is not coming in demanding opioids. I think they're taking back their own health now and beginning to say, these are my options, doctor, or what are my options? Help me out here. And I think a doctor would love to have that conversation because, like, I'm the daughter of a teaching physician, ear, nose, and throat doc. Uh, and he used to say, patients come in knowing exactly what they want before I even tell them what they need. They know what they want, and that used to be true of antibiotics and all sorts of stuff. But so we've come a long way for sure.
That's a really important aspect that you just brought up is patients do often know they use Dr. Google often. And so they're starting to see what their particular problem needs and often what that outcome could be. And when you think through a lot of the outcomes that today's world, when we start focusing on our health and our welfare, is exercise and what your environment is portraying to you. Because a lot of times pain can be so much more worse when you're in a very stressful environment. I'm sure you probably noticed that as well as, if you had back pain and then you had to go into your job, which was very stressful, it only exacerbated that. And we need to have those outlets, whether you're seeing a chiropractor and you're getting on the table and you're expressing, this back pain gets worse when I X, and giving more information, but certainly not coming in expecting like many had done before because they didn't really know the adverse events that come with opiates and that addiction that unfortunately can plague us. And there's a lot to be said about this painful truth campaign because addiction is not something that should be stigmatized. It should be brought up and talked about. And I'm really pleased that you're advocating for that and that you've taken on this challenge. And I know there's parents and loved ones and friends that have someone who's actually struggling with a substance use disorder. And you've probably come up with this question many times: Mary, what do I do?
If you're a parent who's got a child who's struggling,
Yes.
first thing you do is you get help. It's a tough disease in that, again, these are all my opinions. I'm not a doctor. I've just lived with this. I've actually lived with use disorders my whole life with family members. So getting professional help, people who know the journey that you're about to go on, it's absolutely critical. If you had any other disease, cancer, asthma, diabetes, let's go down the roster, you would go to a doctor and get help. This disease is no different. But when you're a parent who loves somebody, it's a difficult disease in that it's a disease that actually fights the patient to stay sick. And what the parent or caregiver, family member is dealing with is something that isn't always logical, to tell you the truth. And so if you get a counselor, and I'm a big believer in therapy, as my friend Patrick Kennedy, the former member of Congress, always says, to get a checkup from the neck up, nothing to be ashamed of there, but to get some sort of help. There are a lot of great books, a lot of great resources, a lot of great nonprofits in this space, a lot of folks who are in the same boat and can hold your hand through the struggles and the challenges. But I would say reach out and begin. The sooner you start, the easier your journey is going to be. And then again, the other part of this is the self-care. It's a disease that takes a toll, not unlike something like somebody who's a caregiver to an Alzheimer's patient or a dementia patient. It can be very hard on the caregiver, and you have to take care of yourself in this case too, if you love somebody who's got any sort of use disorder. But I want to go back to something you said earlier, because I'm still laughing inside when you talked about stress can bring its own pain. There was a time in my congressional career that I was in so much stress that I had the worst TMJ imaginable. I couldn't even get my mouth open. And that was I had so many different manifestations of stress. It's like, seriously, I've got a back that's down my jaw. It's like, what is next? So yeah, stress can be a big thing that kicks off pain and problems. But again, that's another great, you know, example of when to talk to your doctor about something other than an opioid to relieve a symptom of stress.
Well, it's really nice that you could recognize that TMJ disorder, because stress does play so many factors, whether it's I can't fall asleep at night or I can't stay asleep at night. And we know how important sleep is, and recognizing that external environment, that may be step one. And ironically, when you feel stigma, what do you feel? Stress, right? So it's this loop of circular conversation, and someone needs to break it with you. And that's why I think your words are so wise, of having someone there that you can talk to, some very sage advice to start breaking apart these loops, because there's no other therapy that can be as consistent and as opportune as starting to recognize and embrace your whole self and being able to build on that. What do I need and when do I need it? And your family, hopefully they're there for you. And it sounds like, Mary, with your family, they're very supportive to be able to work through this, and you had a very amazing outcome. And I think stigma is one piece that we often try to really reflect on, as being in that spot. It's like watching someone in a swimming pool and you're really trying to help them, but they're scared, there's fear, there's upset, there's this impending doom that they're having, that someone needs to break that loop. And reaching out, here is some help to get you into a safe environment where you can start growing and having different options. And I very much appreciate that. And I did want to ask, as we reflect on how your organization, Mothers Against Prescription Drug Abuse, is really advocating for the patient. When you came across those difficult conversations that perhaps were people were stigmatizing this problem. Could you just share a little bit about how to maybe disarm someone who puts them in a place of stigma? Because I with you love to help people and support them. And when I get in those difficult conversations where you know that person does not understand how difficult it is to pull yourself out of this very um, powerful embraced environment of depending on pain relief through a pill. Tell us how you have disarmed some of the people that you've talked to get this really important message across.
Well, that's still an ongoing struggle for sure. Again, there's always the notion that it's not going to happen to me or to my family. But, stigma is shame. And people are, again, believing this is a moral failing, that you could just pull yourself up and sober up and everything would be fine and dandy. And that's that, when it's nowhere near that easy at all. So it's to get to people to understand. I try to have them lay down their arms a little bit and listen, because the thing is to break through this. It's not going to happen to me. My kid's a good kid. It's not going to happen to my good kid. All of this sort of defensive thinking that people, naturally have when they think of this disease of addiction. But there's a difference. Look, the stigma of somebody who is in an active addiction, who needs treatment and love and empathy, is one thing. But at Mothers Against Prescription Drug Abuse, we are all about prevention, which fits in so perfectly with this Painful Truth campaign. We are all about people not starting in the first place. If we can delay that first use or that first introduction to an opioid, or keep people from, using recreationally, that's what we're all about. So it's both. We do want to say, look, my mantra is drugs are stupid. It's that simple. When there's not a time and a place and prescribed by a doctor and you really need them, of course, that's good. But recreational use of drugs, or a powerful drug when there are other options, it's the conversation of prevention. And prevention, and I know you and all in your field will tell you too, prevention doesn't get enough attention, certainly doesn't get enough funding, because it's impossible to prove a negative that we prevented somebody from getting sick or sore or hurt. It's hard to prove your case. But if we can prevent that, and again, when you can talk about non-opioid options to folks, it fits right into that prevention piece. So it's twofold. Of course, our quest is not only in the medical setting, the clinical setting with a physician, but of course, we're battling the fentanyl epidemic and the illicit supply of drugs, which is a whole nother front on this war of addiction and overdose, is the fentanyl problem in America.
Well, you said some extraordinary things, and one piece is that prevention is the key. And the prevention in many aspects to this is actually having these tough conversations with your teenagers, because you're so right. You're not bad if you're a teenager or you're a young adult or someone who's going through a lot of strife and strain in their life, and you decide that you do end up doing something that's not in your best interest, but you have done it. That doesn't make you a bad person. It makes the choice, the action, not ideal for you. And we have to work through those actions, because all people can look at what our actions are, and it speaks to the total truth of who you want to be. And prevention for so many is starting those conversations with our young teens, our young adolescents, and our early and college, university students, because you do not know as a parent that one-time experiment that can turn deadly. And talking to them, having those conversations, don't think that they already know because it's in the news. Don't think that you can over emphasize the importance of safety and prevention. And with any type of pain, it's always important. Because I was thinking about that the other day, Mary, as I was speaking to someone who was in severe back pain and ended up being addicted to opiates. And she said, I know no one who is not in pain after taking an opiate. Even if you took them when you didn't have pain, as soon as you become addicted, you have mental and physical pain. You could have both at the same time, or you could have one or the other. But the reality is, to prevent that option of being part of your better well care entity, I think, is so important. So you said it beautifully that the stigma is real. We want to open the conversations. Mothers Against Prescription Drug Abuse is such a critical campaign that you have come into because it's the truth. And when you start looking at the painful truth, pain is the projected prevention aspect of this. I think the world will be a better place. And I think, Mary Bono, you have brought us to a place where it is a better place when we come together as a community to really manage, have expectations, and quality of care that is so necessary in today's world. So, Mary, we so very much appreciate you having shared this mission with us. We're going to follow you over time to see all the fabulous work that you're continuing to do. But please tell our listeners, where can they go to learn more about your organization and where to learn more about the Painful Truth campaign?
Thanks, Dr. McAllister. You can visit Mothers Against Prescription Drug Abuse at mapta.net. And you can learn more about our film, which is just a brilliant film, I think, that talks about this issue in a very succinct manner. You can learn about that. Go to Aleve.com/thepainfultruth.
Fantastic. Well, again, we thank you for your service of the many, many years you've been in Congress and your pursuit to a brighter, better, braver world that people can adopt and speak with an open heart and an open mind to help others to prevent prescription drug abuse. So thank you so much for coming on today's Adjusted Reality.
Really great to be with you. Thank you for what you're doing. And I just appreciate the opportunity to be here.
I want to thank you for tuning in to this Adjusted Reality as we spoke to former Congresswoman Mary Bono regarding Mothers Against Prescription Drug Abuse. Now, this podcast was brought to you by the Foundation for Chiropractic Progress. As a special gift for listening today, we want you, your loved ones, your friends, and your family to have the necessary information that you can use in a non-pharmacological way to treat your pain. Neuromusculoskeletal pain is what chiropractors do. So please come to our f4cp.org/opioid-toolkits. You can get the copy of one of our many opioid toolkits. It's filled with research and valuable resources that you can share with your friends and your family, all of which will build a better community for all of us. Because if you're in pain, someone needs to help you up. And that's what we're all about at Adjusted Reality, is a help up. Don't forget to subscribe. You want to share this podcast with your friends and family. Please rate and review. We love all of you. We're in 108 countries now. We want to embrace you. Thank you for listening. Now, if you're feeling so inspired and you want to learn more about chiropractic care, or maybe there's a friend or family member who will need a chiropractor after listening to them talk about their pains, like sitting on an airplane for many, many hours, well, you can find a doctor of chiropractic, in fact, near you. How do? You can go to f4cp.org/find a doctor. Listen, we cannot do this without you. Your support means everything to us. So we look forward to checking in with you again soon.